Welcome. I'm Julie Thompson, Executive Director of PACTV, and today we're hosting a COVID-19 update for the town of Pembroke. We're hosting these forums every Tuesday and Thursday at 9 a.m. Watch in Pembroke on Comcast Channel 15 or online on our streaming channel by visiting pactv.org/live. To ask questions during the forum, email them to pembrokeinfo@pactv.org. For the forum replay schedule and additional Pembroke meeting coverage, please visit pactv.org/Pembroke. Sabrina Chilcott, Pembroke's Assistant Town Manager, will moderate the forum and will introduce the participants that are contributing today. Welcome, Sabrina.
Good morning, Julie. Thank you for having us back. Today is the Thursday Emergency Management PEMA update and question and answer period for anyone at home who has any questions about how the system is working in Pembroke. And I wanted to just take a minute to introduce Deputy Chief of the Fire Department, Ken McCormick, the Lieutenant Rick McDonald from the Pembroke Police Department.
Good morning.
Health Agent Lisa Cullity.
Good morning.
Yay, hey, and State Representative Josh Cutler. Good morning, everyone.
Morning.
Morning.
All right, so it's been a week since we last got together in this kind of a format, and there have been 7 different PEMA meetings. There have been 7 different updates. There's been a lot of activity as the state and particularly our region has started to enter into this surge period. And that will have different effects on different departments, and there will be different things that you're noticing and that you're reacting to. So I wanted to take a minute and start with Lieutenant McDonald. What kinds of changes are you seeing over at the police department? What types of calls are you getting? What have you noticed so far?
Sabrina, nothing significant as far as changes in call volumes for law enforcement. In fact, it's been lower than normal. We're still embracing for that increase based on the length of this event and people's patience being frayed. So that might lead to an increase in domestics.
Very good. The duration of this event has been significant, and this surge that we see around us and in the community, to your point, Pembroke's numbers look very, very good. I wanted to take a minute with Representative Cutler. The state released yesterday individual towns' numbers, and we knew our own, and we're posting them on the pembroke-ma.gov website every day to keep Pembroke residents up to date on what was happening in their community. But you had a nice post, and were able to put it in context with 14 other communities in our area. And not to brag before we turn it over, but Pembroke's lowest rate of spread in your group right now. Can you tell us a little bit about that?
Yeah, Sabrina, thank you. Excuse me, thank you. And so that's good to see. You want to be sort of cautious about all this data because there's some noise in the numbers, but obviously it was great to see the great work that you all have done in Pembroke to promote social distancing is really, seems like it's paying off in the data. We're seeing, in a lot of South Shore towns, some similar numbers, some concerns, obviously, with cities and towns that have long-term care facilities. We're seeing those become a real hotspot in Brockton. In our region, there's a significant increase and uptick in cases there, which is partially attributable to that. But certainly, I think, the positive message in this is that it does look like things are working in terms of social distancing and the efforts that everyone here in Pembroke is undertaking. As sometimes they can be challenging and difficult, but they're paying off, and it's having a beneficial effect. So I guess message would be to sort of stay the course for the time being, as difficult as that can sometimes be.
Well, that's very true. Deputy Chief, how's the fire department doing? What kind of calls? Do you see an increase?
We do. We see a small uptick in calls coming in as of probably Monday, maybe or Sunday. We're doing fine. We're ready to go. We're kind of in a holding pattern, just kind of waiting for that to come. But yeah, there has been an increase in calls. I mean, a lot of the hospital ERs and ICU units are full or semi-full to capacity, so we're getting close.
Do you have any diversion plan, any backup? I mean, I know right now there's a whole protocol in place, but what does that look like for your department?
Well, right now it looks fine. I mean, we as we take them to the hospital, of course, they have the hospitals that are the satellite hospitals that they've set up where we can bring either COVID patients and/or regular patients that they can take care of, and we'll just fill the hospitals up with COVID-19 patients. So they have a plan. The state has a plan. OEMS has a plan on that end of it. TPH and OEMS. We're kind of following OEMS's plan. But we're doing fine right now. We've just seen a lot of uptake in flu-like, seasonal allergy, and some COVID-19 calls.
Got it. Now you guys changed some of the things that you're doing over there in terms of suiting up and having rides, along with the patient in the ambulance. Can you explain some of that before we move on?
Yeah, so we're, this is probably going to become the norm for us in the future. We're going to have to start suiting up, using masks for breathing treatments and things like that, CPAP, where we have to help someone breathe. So we haven't gone away from what we started earlier. We're just kind of reinforcing it. One guy goes in, he dresses up, he takes a look at the call. When he's done, he assesses it, sees what he needs for crews so that we don't contaminate, 4 of the other guys that are on the call. So we limit those people as they go in. When you get to the hospital, there's a procedure at the hospital where only one guy goes in, gets the information, transfers that patient. So these are going to probably be some of the things that we're going to do probably forever here. Decontaminate the station, wearing masks. It's kind of changed the way we do business a little bit.
That's an excellent point, Lisa. We're talking about what we do today, what we can do tomorrow, and some of these changes that have been put into effect and have been so productive and successful to this point. April 16th with a first end date of May 4th. We don't even know if that will really be the day, but we're all working toward that goal right now. But to the deputy chief's point, there are some things that are done in towns and in the private business sector with some of our municipal departments that will never really go back to a different state. And a lot of that has to do with social distancing, disinfecting, and some of those concerns that you have when you're in tight quarters or when you're around other people. Has the health department really given a good look at that and what that will look like in the future?
I think that the Department of Public Health is going to set the standard, if you would, what would become the new standard for most municipalities. I would be surprised if there aren't some regulatory changes that are going to come out of this. I don't think they're going to come out in the immediate aftermath of the event because the State Department, I would imagine, would be focusing on analyzing what occurred, how it occurred, and doing the analytics afterwards. But in general, the state does take a few months to review new protocols before rolling them out. And yes, I would expect that there is going to be some enhanced cleaning and sanitation protocols for general use businesses, but restaurants especially coming out of this. I'd be surprised if there weren't. I would like to think that a great number of the private businesses out there are going to make considerations about how they do things in the future, whether it's how they keep their personal workspaces clean or how they maintain workspace and workspace proximity. I think there's definitely going to be businesses that have realized they can have more employees work remotely. And I think that's going to become more the norm, both as a cost saving measure to the business as well as the employee. But for the fact of, less space, less money is more profit. So I think that's going to be a permanent mark left. But the other thing that I hope becomes a permanent mark out of this is that everyone, the citizens themselves, are paying a lot more attention to personal hygiene, situational awareness when they go out to a supermarket and other things. And I hope that sticks because remember, we're all talking about COVID right now, but diseases are always out there and a heightened sense of hygiene. And I do not mean paranoia. I do not mean fear, but a heightened awareness of how you can contract different viruses, different diseases is always a good thing to be aware of. And it's always a level of hygiene you want to think about and be more wary of. So I hope that's one of the takeaways that comes out of this. And as far as May 4th, I think we all know that the idea that May 4th is going to hold is probably not accurate in Massachusetts. I agree with the deputy chief that we've absolutely had an impact on that curve. But the factuality is, if you look at the hospital numbers in our area, they had a 44% jump in 2 days. That was one of the better reports I read. So the numbers are climbing, and the number of calls are going to climb for both police and fire. And I think we all have to, as citizens, be as respectful as possible of that, be as supportive of that, stay home, try not to get into situations that would require the police or fire to come assist us if they don't need to be. In other words, be smart, stay home, be safe. But I think that the anticipation jump in numbers we see now is a scant few days away rather than the weeks away that we've been looking at for so long.
Okay, and as a follow-up to that, what about things like occupancy numbers, where you have restaurants, even our own recycling center, and some of our look at the police station lobby. I mean, you have some spaces that weren't designed to hold the people, but we've gotten very comfortable as a small town and as a suburban community. We've gotten very comfortable with being, side by side, nice and close, getting in line, queuing up. And what does that look like going forward? And again, I don't mean to ask you to reach into a crystal ball, look into a crystal ball, but I mean,
wait a minute, I will anyway.
Some of these things just are not going to resolve themselves in the short term. And then I'll go with that. And then I have one more. Go ahead.
Sure. No, I completely understand the question. And those are exactly the kinds of regulations that I think are going to be taken a look at. I'm going to be surprised if DPH doesn't come out through the restaurant safety program, some amount of recommendation on what is really a safe density for a square footage of XYZ space. And we all know those super popular boutique, smaller restaurants. Those are the ones where, going in, you're going to be sitting on top of the people next to you. I think those are the establishments that are going to have to take a long, hard look at whether that's the safest thing for their staff, the safest thing for their customers, and reconsider things like that. But seeing occupancy rates reduced per square footage of a food establishment is not something I'd be surprised to see come out of there. And then overall, I'll be very surprised if the state and or towns don't take a look at total occupancy numbers in any number of scenarios and reevaluate what is truly safe. And then we all talked about the reopening and what's that going to look like. I will be very surprised. For example, the levels that have been set, safe levels for supermarkets now being 40% of what would have otherwise been their occupancy. I think as we start to see a relax of regulations, I'm going to be surprised if the state doesn't have some sort of percentage reduction of occupancy of certain spaces as this quote unquote reopening goes. That's something I would expect to see for all types of businesses moving out of this, to move out of this slowly rather than quote unquote open the floodgates or turn on the faucet full force.
No, that's important. Related, I'm going to actually move on, Lisa. I'll come back
please.
on that.
Yes.
But Representative Cutler, you have had a couple of experiences with unique meeting settings and public hearings for the state. And how does this work? And is it successful? And do you have any recommendations? I mean, towns within your district now have to face town meetings and other congregate types of interactions. How's it going at the state level? Can you give us some tips?
Yeah, well, obviously, first off, at the town level, it seems to be going pretty well. I participated in a couple different selectmen's meetings here in Pembroke, and you guys have done a great job of making them accessible and allowing folks to participate. So that's been actually something that I hope we'll take with us when this is all over with, bringing more folks into the process. But I can tell you, Sabrina, at the state level, we're sort of challenged in the sense of we're not able to have formal sessions where we go in and take actual votes. So we have to do things remotely right now. But we did have my committee one of the committees that I serve on, we had our first, and I believe in the history of the Commonwealth, the first ever virtual public hearing where the public was invited to submit testimony on a piece of legislation. And so that happened on Monday. And we had a Zoom meeting like this. There was probably 60 or 70 people who connected in. And it was, went on for several hours, and people offered testimony. And we were able to, as committee members, ask questions. It went pretty well. We did have one Zoom bomber, so I got my first experience with that. But other than that, it went. I don't want to jinx us, by the way. It went very well, and again, it's something that I hope that as we go back to quote unquote normal, that we can maybe continue to do, because it gave people who may not be able to come to the State House or submit written testimony an opportunity to weigh in on public policy issues, from their home, from their place of comfort in many cases. So that was a nice thing. I know today there's another public hearing, and not on my committee, but another committee that's taking testimony on a bill. Long-term care facilities have obviously become really a key point of emphasis for our efforts to combat the outbreak. piece of legislation today being discussed would require daily reports from all long-term care facilities. So just another data point to let us focus, and I know the governor and we are already focusing a lot of resources on our long-term care facilities, just seeing the number of cases, the number of deaths that are arising there. The governor yesterday announced a whole suite of steps that they are taking to address long-term care facilities. But one committee, the Elder Affairs Committee today, will actually be having a virtual hearing on legislation to require daily test data from long-term care facilities. So some positives out of this, I guess, that we are just like the town. We're being forced to re-examine how we do certain things. We did also have on Tuesday our first sort of new budget forecast hearing. Something we do annually, usually in January. But as you might expect, the numbers that we were given in January for forecasting revenues for the next fiscal year are fairly useless at this point. And so this is the first step to try to take another look at where we're at as a Commonwealth, what we can expect to be looking at for our fiscal picture for the next fiscal year, but also rounding out this fiscal year, which ends in a few short months. So that was a new process as well. So we're able to move forward. It's not the same, but we are moving forward, I would say, just as the town and many towns are. I guess when it comes to town meeting, that'll be a little bit of a different challenge for the town, because you can't necessarily do a virtual town meeting, at least practically speaking. So hopefully we'll be at a point where we can have a safe town meeting sometime later this summer. So
True. All right, Julie, would you like to jump in? Do we have some questions out there?
We do. We have a few. The first one probably would be to Josh. There's a number of people who have started to get their stimulus checks or deposits of $1,200 or $2,400, and a lot who have not. Can you speak to that?
Yeah, absolutely. Thank you. So the IRS stimulus checks, the economic impact checks, whatever you want to call them, are starting to flow. And I guess it's a couple things I'd say. Number one, if you filed your federal taxes in 2018 or 2019, or if you're on Social Security or SSDI, you do not need to do anything. You will get your payment. If your direct deposit bank account information is already on file, it will automatically flow to your bank. So if you got a refund in any of the last 2 years from the IRS for your federal taxes, they should have your bank information, and your check will go automatically. It may have already happened if you're one of the lucky early ones. It may take a little longer if you're not. If you did not file a federal tax return for the last 2 years and you're not on Social Security, a small number of folks who may fall into that category because their incomes were low or for some other reason they were not required to file a federal tax return. You should, there's a portal on the IRS website that you should go to. And I would just strongly caution everyone, there's going to be a lot of scams that you're going to see about this. Don't click the IRS is not going to email you. Don't click any links. Be very careful about anything where you see, enter your bank account information here. I would just counsel everyone to just go directly to irs.gov and follow the prompts there. Don't even Google it. Just go to irs.gov, type it into your web browser. And that way, you could be at least more sure that you're not going to be subject to some, phishing type scam. But they do have a portal where you can go in and enter your bank account information so that the IRS will.
Okay. Looks like we lost Josh's signal for a second. We'll get back to him. Lisa, a question about two questions for you, I think. One is about the people that do go to work and are essential workers. Is it toxic at all to be in an environment where you're constantly using bleaches and cleaners like that? And is it recommended that those workplaces air out their facility once in a while?
Yeah. So the important thing to remember about this is I kind of never understood from the beginning the let's bleach everything. This is a very easily killed bug. Soap and water takes this guy out. If you're using any kind of bleach to clean, you want to be diluting that properly. It's a 5% bleach solution as far as a cleaning agent. In the work environments I've been in, most people have been doing Lysol or a Lysol type product, which should not have any toxicity to it. Having said all that, most places are using that to spray surfaces that are being touched, whether it be phones, computers, and other things like that. I think I would hope it's common sense, but I'll state it to be certain. You should not be touching those things and then touching your eyes, nose, mouth, or anything else. You should be washing your hands before you have to touch your face or your eye, or avoiding that if possible. So if being used properly, no, just a heightened amount of cleaning should not present any health harm to anybody. Should people be making cocktails of their own types of cleaning solutions? No. We all know the danger of bleach and ammonia and some of those other things. So no one would be advised, whether it be a business or in your own home, to start mixing up your own cocktails to try to, quote unquote, kill the virus. This virus is a very easily, from a medical standpoint, eliminated virus. So just good regular cleaning of surfaces, regular cleaning of floors, certainly cleaning of phones and things you touch often. That's actually a good point to touch on. So all of us with our cell phones, I hope everyone at home is taking a nice Clorox wipe or something like that to your cell phone periodically. And giving that a good wipe down. But as far as a regular business doing regular cleaning and maintenance of a workspace, that shouldn't present a health hazard. Again, should not be concocting your own quote unquote cleaning mix. That's not a good scenario. You should be using a professionally manufactured product, and you should be using it with the recommendations and the usages and the dosage levels of that product as it comes to you.
Okay. Thank you. I would assume that you would agree that if you can air out your facility, you should do so. Is that true?
Always helpful.
Yeah.
If it can be done, always helpful.
Yep. Yeah. Okay. Another question to you, Lisa, and it is in regards to the in South Dakota, the pork plant, the meat processing plant that had such an incredible outbreak of the employees that work there. And the question
Really
is,
sad.
is the food that we buy, even if it's packaged a while ago, is it safe?
It should be, but there's no guarantees on this. And I think that's where it can get a little nerve-wracking. There's debate even among scientists just how long this bug lives on surfaces and what kind of surfaces can transmit it. I read a report one time that it's usually dead and inactive after 48 hours, and then you're reading, for example, the cruise ship where it was alive, I believe 17 days later. That's a really long time. So I think that there's not an amount of certainty there that you can say after this period of time on this product it is dead. This is still an emerging infectious disease, and a lot of people still are forgetting that component of it, that this was only really big as of January. So all those studies we would do on, say, any other type of disease, E. coli, let's pick E. coli because it's an easy one to talk about with food. Well, hundreds and thousands of studies have been done on E. coli and its survivability and what kind of surfaces and how long and what kind of agents and processing is more effective on it. So we can be really definitive that, for example, chicken presents the threat of E. coli and you need to do this and you need to cook it to that temperature to be sure that it's eliminated. The problem with the corona or the COVID-19, let's call it exactly what it is we just don't know enough yet to be certain. However, with any food product, you always want to cook it to appropriate times and temperatures. So let's talk about the particular plant, which is a pork processing plant. You want to be cooking your pork to 160 degrees of an internal temperature. You want to be cooking it until it is done. You don't want pork that is pink. And yes, I know there's gourmet chefs that will say you don't have to overcook food. But in a situation like this is not one where I'd take the risk. I'm going for that 160 if I am going to eat a pork product. And frankly, I love bacon and it better be crisp, because if it isn't crisp and brown, I'm not eating it.
Okay, thank you so much. And last one for you, does freezing and or boiling kill this virus?
I've not seen definitive data on that, but yes, it would appear right now that boiling and freezing are taking this virus out. Again, how much studies done on this? Who's done those studies? How definitive are they? When you take a scientific approach to any of this, you want multiple repeated studies to be certain. But right now, I don't see any evidence that it's surviving those extremities. So until all the studies are done, I'm not going to swear one way or another. I'm sorry, I'm a scientist at heart. But at first pass, at first blush, yes, it appears that freezing and or boiling is eliminating this guy.
Okay, great. I do have one more question. Did we get Josh back? No? Okay.
It looks like he's coming in now.
Oh, he's coming in now. Okay. We'll wait for Josh to reconnect because I have a question. A lot of people have. Hi,
back,
Josh.
I think.
You're back. A lot of people have been really concerned about trying to apply for unemployment, and either they can't get through or they think they get through and they think they applied, but they don't hear anything back. Do you have any update on that?
Sure. Sorry about the technical difficulty. I'm not sure what happened there. But yes, so in terms of unemployment, number one, regular unemployment, you can apply. Obviously, their call center, we've gone from 50 employees to now 500 plus, getting 6,000 inquiries a day. So they are a little backed up. I would suggest a couple things. One is, if you haven't already and you're new to this, go through and do one of the virtual town halls with DUA. So it kind of walks you through the steps, and you can ask questions. There's a Zoom presentation just like this. So do that. If you've already applied and you're having some trouble, there is an online form you can fill out for a callback request. They are happening. It's taking a while for people. There's a bit of a delay, but people are getting responses. So I would suggest you do that. If all those things fail, please reach out to my office, and we'll try to do whatever we can to help. We can't do any instant results, but we can try to help as well. So you can reach out to me. Best way to get me is actually just to email josh.cutler@mahouse.gov. The other thing I'd say for folks who are self-employed or 1099 gig economy workers, we're still waiting for the portal to be open for those folks. The date the governor gave is April 30th or thereabouts. We're hoping that'll be a little sooner. But yesterday, the Department of Unemployment did post some new information about self-employed and gig workers policies. It's not open yet, but I would recommend folks go to the mass.gov website and read it over, because it had some good information about what are the documents you'll need to have, who's going to be eligible, so that when you're ready to go, when the portal is open, you have everything you need and you can apply. As you can imagine, if you're a 1099 worker where you don't have the traditional documentation that you'd have as an employee with a W-2 form, the process is going to be a little bit different, and that's partially why it's taking some extra time to go online. The last thing I would say is that the other benefit, in addition to there's the three benefits. There's a benefit to independent contractors and self-employed. There's the extra $600 a week for everyone, and then there's the extra 13 weeks. And I just had an inquiry this morning from someone asking about that. The additional 13 weeks that the CARES Act provided for, that too is not live yet. That will be coming online soon. So if you were already on unemployment and you're concerned about running out, you will be getting an extra 13 weeks. I expect that'll be around the same time frame as the self-employed portal, but we don't have any specific deadlines given on those yet. But those benefits will be live. And I would say for all those benefits, they are retroactive. So even if it takes a little bit longer to get your claim processed, you still will get the funds in a retroactive basis. So you won't be losing out because of this delay. So have a little patience, try those steps. If those fail, let me know and we'll be glad to help.
Great, thank you. Really important, the whole idea that it's retroactive, because a lot of people don't realize that. The other thing is, we had talked about this, getting and it's not called a stimulus check, it's called an economic impact payment. So I'm just going to throw this up on the screen. If you go to irs.gov and type in Get My Payment, there's an entire page here that's all about how you get it, what you need to do if you hadn't filed, etc. Go ahead, Josh.
I was going to say, if you could bring that back up again, I just wanted to point out something, and maybe we can't. But anytime you're doing, if you scroll to the top of that, I don't know if you can see it, there's a little lock icon next to your browser, and it indicates it's a secure site, and it's HTTPS at the end.
Yeah.
And that's just a good caution. Yeah, you can see it there. That's just a good thing for anybody to always look at anytime you're visiting the website where you're putting in payment information. Always look to make sure you see that little lock icon that's indicating that it's a secure protocol and that your data is not being put at risk.
Right. Perfect. Thank you. Good point. Okay, that was all the questions I had. Sabrina.
Thank you very much. Lisa, earlier it was referenced that we have or every town has some facilities, group facilities, where you have some of your folks who are the most impacted or the most potentially impacted. As far as Pembroke goes, can you talk a little bit about what you, the deputy chief and lieutenant, are observing and what kinds of communications you've had with them?
Absolutely. We're in contact with those group type living facilities almost daily, one of the three of us. We're maintaining that contact for the safety of those populations. We're trying to support those living facilities as much as we can. We're supporting them with physical support, gear, mask, things of those nature. We are also giving them resource support, such as information, idea sharing, directive sharing that might have come down from the state. At this time, we know one of them had a couple of employees that had tested positive, but luckily it does not seem to have gone into the rest of their population. We know a second organization is in full quarantine because they had a resident that tested positive, but luckily there have not been any additional cases. And then the last facility, they also have had an employee positive. And they're responding appropriately to that. So in all of those scenarios, the kinds of things that are being done, obviously the populations within all of those different living arrangements are no longer interacting with each other. That was kind of an obvious one from the beginning, but also for those facilities that are of a size that we can quote unquote break out the population. For example, I'll use a hospital just as an example. People are not leaving their floor and their wing. So we're taking a hospital of whatever size and actually breaking it down further into pods or wings, however you want to refer that, and not having staff and patient population cross between one and another. So it kind of takes a larger facility and breaks it down into 4 or 5 smaller facilities within an organization. And all of them are doing that. And all of them are doing that and not having staff and population move between those different units. What that does is that limits the travel of the virus if it would get into those facilities. And further, it also limits the possibility for cross-contamination within the facility, which is so important. As everyone knows, you have to have droplets leave one human being and go into another human being to transfer this virus. So the less human beings are interacting with each other, the more we quote unquote break the chain that the virus would use to move from person to person.
Okay, it's been 30 days since Pembroke's first positive case. It's a strange little anniversary. And they're just saying now that we're very early into a surge. So it took a while to get here. It's starting off slowly. What do you anticipate over the course of the next week? What kinds of things are you expecting to see just through the normal course of the potential increase in speed and pathway lanes that this could take? And not about human behavior. I just mean in terms of what this virus could look like over the course of a week.
You want me to take out my crystal ball again?
Yes, I do. Yes, I do. Yes.
So again, I have to step back and be a scientist for a minute, but as a scientist, what the data is telling us is that those cases are on the rise. The data is telling us that from the number of transports that the fire department's doing. The data is telling us that from the number of admittances into our local hospitals. The fact that they had a 40 to 45% jump in the last 2 days is telling us something. So yes, the surge is coming. The surge is here. What I expect from that data, the best prediction we can do is between now, today, literally, and Tuesday, I would expect those numbers are going to escalate. I expect that those numbers of new cases are not going to be the onesies and twosies and threes that we've seen. I expect those to go, to double and triple, possibly even to the double digits per day. I expect, unfortunately, sorry, Ken, for the fire department to start being a lot more busy with transport. DPH has rolled out the next phase for hospitals. And while every hospital and every facility that I'm aware of has a field unit to it, my understanding of what that's going to look like and could change tomorrow is that the hospitals are still going to do an admittance of all employees and then, of all patients, and then redeploy through their facility as they see fit. In other words, depending on how they've broken out their facility and the severity of the individual being brought to the door is going to dictate whether they might end up in a field facility, a certain wing of the hospital, or whatnot, depending on the case. But that is what it looks like today. That's what the DPH directive is today. Again, could change tomorrow. And I don't want people to be alarmed, but I want people to be prepared to start to see those numbers to jump. Even though, Pembroke's at the quote unquote low end of the spectrum, I would also echo what the state representative said, that don't read overly much into that data. Yes, it's fantastic that the numbers are lower. However, they're not going to remain there. They are going to jump. I think the good news to take away from this is everyone keeps saying, well, we've been waiting forever for this peak. We've been saying the peak's coming for weeks. Well, it's good. every day that we're not peaking, every day that we're not taking off is one more day that the hospitals have to get their gear ready, their staff ready, the ventilators ready, these field hospitals ready. And every day that the surge isn't happening, it means we flatten that curve a little bit more. So I know it's the hardest thing in the world for the people at home to hear right now is please be patient, but here it is. Please be patient. This isn't, I've said it 100 times. It's not a race. It's not a sprint. It's not a marathon. I'm not even calling it a marathon anymore. It's now an ultra marathon. And that's what we're in for to get through this. And I realize people's patience is wearing thin, but I'm just going to ask them dig deep, try to find a little bit more, try to do the best you can. And hopefully we'll get through this with as minimal loss of life as possible.
Thank you. Deputy, you're going to see this crowd again on the 23rd. That's a week away, and there's going to be a lot that happens between now and then. Can you build on Lisa's point? As EMS, what would you really hope people take from this in the next few days as they start to hear different types of things than they've heard before?
Yeah, I know. I mean, the information changes daily, as both Josh and Lisa have said. So I'm going to say what I've said for the last 7 weeks. We need to continue to do what we've been doing and not mess it up. People have sacrificed a lot to get to where we are today. We have flattened the curve. It's anticipated, whether we flattened the curve or we didn't, that we were going to have some high numbers at some particular point, and that's coming. EMS, your fire department's ready to go. Knock on wood, all of our staff is healthy. We haven't had any issues with staff-related illness. So we're ready to go. So just stay at home if you can, social distance if you can, and kind of wait for the peak to happen, and let's not mess it up because we've had a couple good days of weather, or people are just getting anxious and want to get out. The storm we had the other day really didn't help. So we kind of lost one day because people had to get out of the house, and I understand that. But just try to stay home. Don't mess it up. We'll get through this, like Lisa said, with the minimal loss of life and hopefully a minimal amount of cases, and we'll come out the other side better for it.
Thank you. Lieutenant, on the police department side, what is the department looking to see from Pembroke residents and their level of patience that up until now has been so good? But you've got this 5-day window between now and next week when we get together again on one of these forums to have a moment to speak to everyone and bring that departmental message forward, because it's been a long road and it's going to be longer.
Well, we're going to continue to educate the general public about the stay-at-home orders. Our first goal is to gain voluntary compliance instead of doing any law enforcement action. We keep our shifts fully manned. We're out there to increase visibility, to be there for the public needs, to reinforce the optic that we are here and stronger than ever.
And how are you handling first approaches? As you just pointed out, it's not about enforcement education in the beginning. So how are those contacts going?
They're going fairly smooth. I mean, you'll see the officers now wearing the surgical masks pretty much on all calls. And we're trying to keep our safe distance also. And people have been pretty much cooperating with that. And that might change as the state increases their restrictions. We'll have to look at it at that time when it happens.
Understood. Representative Cutler, Tuesday, the Board of Selectmen are going to bring forward further discussion on some of the town's financial and economic impacts. And that also has, that's going to have a effect from the state and some of the discussions you guys have been having. I don't want to close it on a grim note, but as far as the end of this fiscal year alone, because of the impact today, versus the impact we're still trying to predict for next year. Can you talk about that a little bit?
Yeah, sure. So it's going to be hard not to end on a negative note, but the term that was used a lot, if you had a bingo card, would have been sobering, was the word that was used during our budget hearing. So we had experts, economists from academia and from the business world and from government testifying and sharing kind of their analysis of where the Commonwealth is at in terms of our revenue picture for the next fiscal year. And obviously that's not an exact science, much like the weather, or maybe somewhat worse than the weather. But the predictions that we're hearing for folks, and I guess there's 4 letters that were used. People may have already heard some of these. You have the V-shaped recovery, which we all hope this is, where it bounces back up right away. You have the U-shaped recovery, where it takes a little longer, but it goes back up. You have the L, which is the not a good outcome at all. You can do the visual there. And then the W, where we have a sort of a double whammy. So different takes on that. We definitely going to be looking at a loss in revenue, which is obviously expected. Pegging that number is difficult, but we heard estimates of around $4.5 billion in lower revenues than we expected for next fiscal year. So obviously that's going to be a challenge from a budgetary point of view. We also, we're still in this fiscal year through July until July, and there is going to be some impact. They expect up to $500 million in reduced revenues through this fiscal year. Now, the good news, I guess, just to end on a slightly more positive note, is that Massachusetts does have a pretty sizable rainy day fund, stabilization fund, we call it. It's over $3 billion, and we've built it up over the last few years, especially since the Great Recession. So that will help to, at least in the short term, to stabilize things. And I expect, I'm sure we'll have to be drawing from that, because obviously, if there was ever a day when it was raining, it's now. But there's going to still be, some belt tightening that's going to have to happen, obviously, down the road. So.
Sure. And Lisa, I'm going to wrap around, if you don't mind. If Pembroke takes the same approach as I'm sure other towns will also have to do, based on some of these numbers coming out, belt tightening looks different under different conditions. With the, again, crystal ball that you've got sitting right in front of you, the town of Pembroke has to make some choices going into the fall. And we're going to be taking a good hard look at the entire scope and picture. Some of the remote opportunities and abilities that the town has had to pivot with more technology and less staff, or maximizing the impact of the staff. Is there anything that can take the place of some of this outreach? I mean, for the most part, we're seeing some of our populations really relying on the outreach that's going on between the Council on Aging director picking up the phone for pantry customers and so forth. Can you talk a little bit about some of these cross populations and how they've been and brought up in a very real way during this time? I mean, that's important to know how we function when we're as tight and streamlined as we are now. Can you explain a little bit about that?
Sure. I think technology has proven to be our friend. I think that if we looked back and had this scenario even 5 years ago happen, it would look very different. The communication I would be able to maintain with the population would be different. The communication that even the COA or our housing or anyone else would be able to maintain with their population would be different. Certainly it's more challenging with a more senior population that is not technology friendly, but I'll just, an anecdote of a conversation I had yesterday was actually a concerned relative of a senior who is more technologically savvy and been taught to be more technologically savvy. And that has led to that person being less isolated. But the other takeaway I would say is from the other than the person-to-person use of technology, to not be as isolated and to be able to do so many things. Think about all the banking we can do over the internet, or as Josh Cutler said, the IRS work and getting payments that's been able to be done from an automated and a non-person-to-person manner. So now let's take that and apply that to local government. I think the majority of us know that local governments are the most behind, certainly far behind private business, far behind the state level, as the state has demonstrated aptly of what they are able to do. And I applaud the human effort that's been put into filling those gaps, done again by our COA, but every department here in town, treasurer collector, assessors, accounting, you name it. Every department here has been using technology to their number one advantage to fill in some of those gaps. But what I would expect long range to come out of this, I think towns have gotten a wake-up call, for lack of a better term, of where technology, online platforming, moving things to the cloud. I know that Pembroke would not be operating as well as it is without some of the things we've moved to the cloud. And I think coming out of this, if the state and the towns, the municipalities don't invest more in this technology and putting more data on technological platforms and advancing the technology capabilities of communities, I think we're going to see an opportunity to streamline government, make government more responsive and more effective, and that, God forbid, if things like this happened again in the future, to have less government shutdown and less loss of service to people. So it would be my takeaway that I will be surprised if the state doesn't make investments in this. I will be surprised if coming out of this, voters and municipalities don't want to make more investments in this.
No, that's an excellent point. Thank you. Thank you. And again, I guess it's difficult to talk about investments when you're talking about a reduced shrinking
brutal.
wallet. But
It's brutal.
well, it's true though, because there are always, the services people want and the people need and that they deserve for what they pay to support their governments. But yeah, choices ultimately may need to be, deliberated. So thank you very, very much. Before we go, I just wanted to say, first of all, thank you and ask for just a last takeaway. Lieutenant, what do you have to say?
Ask people to respect our social distancing and, if possible, wear some type of facial covering if we come to your place for whatever reason.
Thank you very much. Deputy?
My saying for the last 7 weeks, don't screw it up.
Oops.
That's the perfect way. Perfect way.
That's it. He just dropped the mic. I think he just dropped the mic.
Absolutely. Representative Cutler, what do you have to let all of us know and to hold on to for a week? Go ahead.
I don't know if I can top that. Thank you. Obviously, listen to the public health and the safety experts. That's not me, but where my office can help is with some of the economic issues. And I'd encourage folks to reach out if we can be of assistance. Josh.cutler@mahouse.gov is that email.
Thank you very much. And Lisa, want to close it out before we send it to Julie?
Absolutely. So quickly, facial coverings are good. Yes, that's not an order. Is it still smart? Yes, of course it is. I echo the deputy chief. Don't mess it up now. We've all sacrificed so much personally, economically, and otherwise. Don't screw it up now. And last but not least, I know there's a lot of people that still are like, well, it's not that bad, or maybe I'll just, and I'll wrap it up with that conversation I had with the resident last night. Are you willing to bet your life on it? Are you willing to bet your loved one's life on it, that it's not that bad and it's not that dangerous? Are you willing to gamble that much? And you know what? Their answer was no, and my answer would be no. So when in doubt, don't do it. When in doubt, be safe. When in doubt, stay in. When in doubt, stay at that social distancing, wear that face covering, because otherwise, is it worth the gamble if you don't? That's the reality.
Thank you, Lisa. Julie, thank you once again for hosting. We're very grateful to PACTV and the services that you provide to the town of Pembroke.
Thank you, Sabrina, and thank you all. Just before we go, and on Lisa's note about the technology, I'm going to bring up the Pembroke website, which is updated daily. It's wonderful. And if you go to the right here, the red banner, you will get the daily updates, and you can even see that it was updated today. So every single day, you're going to be getting up-to-date information from your town. They're working 24/7, all of them. If you notice, we date stamp this particular episode. We're going to date stamp every day because information does change every day. If you want to watch this forum again or any of the forums we've had, go to pactv.org/Pembroke. We will see you every Tuesday and Thursday at 9 a.m. We thank you so much. Keep safe, social distance, wash your hands. We'll get through it together.